Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. And we're going to try to give you some good information because most of the questions that we're going to ask have come from you, the viewing audience. So thank you for being here. Today we have two really wonderful people. It's part of the critical care teams at Broward Health Medical Center, a very dear friend, and not only to me personally, but also to our healthcare programs at Nova Southeastern University, Sunil Kumar, who is a critical care specialist and a pulmonologist. Welcome, Dr. Kumar.
Thank you, sir.
Good to have you. And we have, I'm going to carefully say this, a long-standing participant in providing care at Broward Health Medical Center. You notice I didn't say an old-timer. Andrea Karpiak, who is a nurse professional, and she's got a lot of acronyms after her name. Ms. Karpiak, tell us what those acronyms are.
Well, I've graduated from a college in New York, upstate New York, SUNY Brockport, where I got my bachelor's in nursing. Became a registered nurse there. Only practiced ever in Florida, but worked down here for about 2 years at Broward Health, and then transitioned into critical care, where then I studied for and earned my CCRN. So, and I've been here for almost coming on 18 years.
Well, we're proud of having people like you at Broward Health. Thank you for your service. Dr. Kumar, tell me about the critical care teams.
So we started what we call an intensivist program here at Broward Health Medical Center about 2 years ago. My group's name is Denman Intensivist. And this is something that we have been planning for quite a long time. And I've been very passionate about starting that program here at Broward Health. And I'm extremely happy that we have been able to implement it right on time, right before the pandemic. So it's been perfect timing for Broward Health.
Yes, this insidious viral entity, this COVID-19, has really, I don't want to say, has brought a tremendous view by the public on our healthcare providers, the whole team, because the collaborative efforts that are necessary to deal with a pandemic is absolutely an imperative. Correct?
Yes, absolutely. It's been a very stressful, but at the same time, a person who's working in critical care, it's been rewarding that we were able to help so many thousands of patients, not just here at Broward Health Medical Center, the entire system. And of course, the professionals all over the country and all over the world went through the same thing. It's just, it's been different. It's been a very unusual last 14 months.
Absolutely. Ms. Karpiak, I would assume the same could be said by you as to what Dr. Kumar said, but talk about the capability of your nursing contingent and the people around you.
So I think as it pertains to the intensivist program and COVID right now, I'm really proud of all the nurses, everything that we've done over the, past year plus. The intensivist program has been imperative, especially during COVID, not only COVID, but our other patient populations as well. And I really think, as you said before, collaborative effort, the nursing and doctors and other disciplines working together has really been fine-tuned this past year.
The Broward Health system has taken on since the inception of the creation of trauma services in the state of Florida. I know that the critical care element of that, putting COVID aside for a minute, it has been paramount in the nature in which you have been able to care for and save people's lives.
Yeah, absolutely. It's been an awakening experience, like you said, besides COVID, but now getting to work with the intensivists and having a whole different approach to medicine has really saved time. It's improved our patient outcomes. And I think because of the intensivist program, we've really been able to manage having the trauma center, having the COVID unit. We also do medical, transplant. We're multi-managing many things on top of COVID. So this couldn't have come at a better time. And I know it's something that Dr. Kumar has been very passionate about for a long time. And we've all been very supportive of that. So I'm very glad to see it come to fruition.
Dr. Kumar, talk to me about the critical care structure and the intensivist program. Give the people the idea as to why it's special.
So the group's name again is Dhanwan Intensivist Group. So intensivist is a critical care physician who specialized in taking care of the most sickest patients in the hospital. So they function as a core physician in ICUs or intensive care units. So these are patients who are medically complex patients. They could be surgically complex patients. So all different types of patients we see. As you know, at Broward Health Medical Center, we are a level 1 trauma center. We are also a transplant center. So we have all kinds of complex cases that we handle. So prior to intensivist program, it was an open ICU where physicians admit patients and they consult different specialists. And, we all come in, see our patients, do whatever we need to do to take care of the patients. And we all go to our offices or, go home. And the rest of the management is from off-site. So if something is happening, nurses will call and we respond to those calls. And obviously there are glitches in that whole system, which is not a perfect system. So we, intensivist programs are, critical care as a field only started in the mid 90s. That's when the whole field evolved. And now pretty much a lot of the hospitals have now intensivist program. So now these intensivists stay in the hospital. They are available 24/7. So it makes that entire communication structure and functioning of taking care of these sick patients much more easier and much more smoother. And that is probably the best way to provide care in an ICU setting.
The evolution of healthcare, the changes that have occurred within the last decade, and now even more, it's going to be more and more and more, because we finally have woken up as a society that we have a healthcare shortage of people who are educated in the systems, and I really believe that the whole theory of intensivist programs are really rather helpful and really, as I would say, fantastic for the people that are viewing this particular show, because they're the ones that end up, unfortunately, because of illness, etc., in the hands of a highly qualified collaborative system, which now can care for them as a whole body, just as the unit itself works as a whole body. Is that correct?
That's correct. So the intensivist program is headed by the physician, but absolutely it is teamwork. So we are able to, with the presence of that critical care physician and with the phenomenal nurses we have in ICU, we collaborate with the rest of the team, the respiratory therapists, there's critical care pharmacists, there's physical therapy, there's speech pathologists. So we put together this whole team, and it's a multidisciplinary approach to taking care of that single patient, which in my opinion, and this is supported by data, that's the best way to take care of the most sickest patients in the hospital.
Absolutely. I'm so pleased and proud of the establishment of these intensivist programs.
Absolutely. Absolutely. I mean, no one person can know everything, and no one person will find everything that's happening to a patient on a daily basis. So we put all these minds together, when the nurses, respiratory, pharmacy, when we all come together as a group, I mean, we can do phenomenal things. And that's what we've been doing for the last couple of years here at Broward Health Medical Center.
Well, that's why we're so proud of being affiliated and associated educationally with you all for these many decades. Andrea Karpiak, tell me, because, and again, I don't want to just stick on this phrase all the time that the pandemic has brought more attention to certain elements of healthcare, but there isn't one area that has been, I guess, viewed more, I guess, with a feel of almost love and sensational, shall we say, adoration than nursing. And this does not demean any of the other healthcare providers, but you see it on television every single day. You see it. So how has it affected your operation, your people, Andrea?
Well, I think that especially for nursing and COVID, one of the reasons why I think families really started to realize is because they couldn't come and visit their loved ones anymore during the worst times. They were critical, not doing well. And we were the ones at the bedside, maybe FaceTiming them, if that's the only option. In the beginning of the pandemic, we couldn't have anybody in these rooms. So I think they really got to see the severity of what was going on without actually being in there, the amount of apparel and masks, and it can be a little scary for people who don't know medicine, and just to see the community and maybe their loved ones getting sick, and then having us at the other end of those calls or FaceTime calls and things like that probably put it into a little bit of a different perspective than what they were used to prior.
Oh, no question about it. No question about it. Dr. Kumar, now there's a very interesting thing. We did a show recently where we had some certified, I guess you could say, fire EMT people that have stated on the show that a lot of folks resist after they call 911, and they resist going to the hospital. Now, I don't know whether that has been curtailed because we finally have reduced the number of cases of the COVID in hospitals. But did you see some of that? Do you see some of that? Because there are people that need this intensivist work in the critical care units that are resisting going to hospitals.
Yes, we actually saw that, especially in the beginning of the pandemic. But we have to understand something. There were a lot of unknown factors in the beginning, right? Nobody knew exactly what this disease is. And we were all struggling to find out what works and what didn't work. So there were a lot of unanswered questions. So you're absolutely right. A lot of our patients, they did not want to come to the hospital. But here at the hospital at Broward Health Medical Center, what we have been able to do, which is very important, is we actually separated the hospital, if I may use the word, even in ICU, we created a separate intensive care unit just for our COVID patients. So we were able to separate them from our regular ICU. And also on the regular floors, we separated a COVID floor just for COVID patients, and the rest of the hospital was separated from that. So we were able to do that. And we have an amazing administrative team here that supported us in all the initiatives that we wanted to implement. And that was amazing. So that collaborative attitude really helped us. So we did that. And then we started talking to our patients about how safe the hospitals are and why it is so important to take care of their other medical issues and not just COVID, and convince them to come back to the hospital. So now I would say in the last 3 to 4 months, a lot of patients have started coming back to take care of their other issues, which were delayed. And we definitely saw some bad results from those delays as well. So it's been challenging, to put it mild.
Well, the reason I bring it up is because I always tell our viewers, and I've been doing it now for 21 years, telling our viewers that you can't hide your illness or your pain. You need to talk to your doctors. You need to seek their help. They're the ones with the knowledge. And it really was remarkable to hear the captain of this group of EMTs tell me as to the fact that so many people resisted. They more than resisted. They said, "I'm not going to the hospital," when it was necessary for the intervention of people with knowledge, such as your intensivists, to care for them, to prevent them from either passing on or having some really significant problems in a very near future. So I'm glad that we got to talk about that. Let me just ask you another question with reference to what the people have asked. There are, and I don't know whether anyone has the answer yet, but there are a number of issues that are being talked about in the media, whether it be print or television, about the sequelae, the effects after COVID. Have you seen much of that come to your intensivist program?
So there are two groups of patients that we are seeing. We call the long haulers, all of them together. Some of these patients we are seeing in the outpatient clinic, and some of them we are actually seeing in the hospital as well. So they had COVID. Some of them were not very symptomatic, and they got better at home. And then 4 weeks, 5 weeks later, they're starting to develop more shortness of breath, trouble breathing, and they come in. And just like in pediatrics, now we are starting to see that we call the multi-system inflammatory disease. It's a new presentation that we haven't seen in the beginning of this pandemic, because I think we are also focusing on the acute illness itself. But the post-illness phase is now more and more patients are showing up. And also in the outpatient clinics, patients are, several weeks after the disease, they come in with this ongoing headaches, and they get some chills on and off. The biggest or the most common symptom we are seeing is fatigue, and they just not able to get back to their performance level. And this is something that we're going to have to deal with for quite some time. And we are seeing more and more.
Yes, we've heard just recently, and we did a broadcast where there's been problems relative to even things as natural as walking or balance or, taste, things of that nature, which can be approached with the good medical knowledge that you all have to provide these people not only intervention into their problems, but remove them from what I would call the mental anguish. There seems to be a lot of mental anguish with reference to some of these after effects or the sequelae, as they say. I'm sure that you must have, you just basically stated that in some of your previous statement, but it's going to be something that's going to be hanging around for a while.
Absolutely. It's going to be challenging. And again, we're all learning about these new syndromes as we go along. Every day we're learning something new, even today, right? So yeah, you're absolutely right. We're going to deal with this for quite some time.
Andrea Karpiak, again, what I call the near-heroic work of your colleagues in nursing and the various other entities that Dr. Kumar spoke about, the respiratory therapists, the occupational therapists, the physical therapists, et cetera, et cetera. You know, it's got to be very pleasing to you to see the type of cooperative response that your critical care team in nursing has obligated itself to.
It's been amazing to see everyone come together. I do feel like nurses get a lot of recognition, you know, and I think physical therapy and occupational therapy can come along a little bit later after critical care. In our hospital, it's a little bit lighter on the critical care side, more towards when you're getting out of critical care. Do you see that? But really, the respiratory therapists here are just absolutely amazing. I don't think they're spoken about enough as they should be. The things that they do and the knowledge that they have is just amazing. Very proud of the people I work with.
If I may add one more thing to what Andrea just said, I mean, honestly, me and my intensivist team, we couldn't have functioned or we couldn't have done anything without this phenomenal nurses and respiratory therapists. They're 24/7, and they really took the leadership of taking care of these patients. I'm lucky enough to work with the best in the business. No question about that at Broward Health Medical Center.
That's great. And you mentioned before the support of the administrative functions at Broward Health. Of course, with someone like Shane Strum coming on, who I've known for many, many years, and has a dedication not only to the community but to healthcare, I think it's going to be very valuable to you.
Absolutely. With Shane's knowledge and experience and the community support that he has, I think we are in the right direction. Even though, you know, we were little when Gina was leaving, we were not sure, you know, are we going to continue to go in the same direction? And today I can tell you we are relieved and happy that Shane is taking us in that direction. And not only that, my CEO here at Broward Health Medical Center, Heather Miller, well, I should say Heather Havachak, she's an amazing leader. And she's not just an administrator who directs things from the administrative office. She has been with us and on the ground, so working with us and directing things, and it's been amazing. And it just this last 1 year, we've been able to do things together more than we ever thought.
Well, that's good. It's good to hear it because again, I know these individuals personally. I don't get into personal comments on this broadcast often, maybe once or twice in 21 years, but I just did it. And what I'm saying is that I'm pleased for programs such as yours, because this is not new medicine, but it's newly respected venue medicine that I believe is what we are going to be looking at in the future. No question.
Yeah, so intensivist programs are are going to be started in every single hospital. So there are multiple reasons for that. So if we take just a benefit of having an intensivist program, it benefits patient care, it benefits nursing, it benefits the intensivists and the rest of the physicians taking care of the patients, and also it benefits a hospital in multiple different ways. I could explain one by one what those benefits are. And also it's one of the regulatory standards that we have to follow. So there are several different reasons these programs are going to be started everywhere.
Okay, well, I don't mean to be interrupting you, but we're down to the last 10 seconds of this show. And I want to say thank you to Dr. Kumar, a wonderful physician that I happen to know personally, but more importantly, the community should know of his dedication and his advocacy for good care. And I appreciate it, Dr. Kumar, for you being here today. And Andrea Karpiak, thank you kindly for your dedication as not only as a nurse professional, but as a leader in aiding this intensivist program and the critical care teams to be as functional and as available as they are. So thank you very much, Andrea. Folks, I hope that we gave you some answers to your questions. Remember, I always say that in order to take good care of yourself, you have to communicate with your physicians and the people who are taking care of you, because if you don't tell them everything, then you're cheating yourself. So take good care of yourself. Remember, this program is called Dateline Health. We come to you from Nova Southeastern University. My name is Fred Lippman. Until next time, see you.